wrist joint. So for this purpose, we will have some of the learning objective are student will be able to know the anatomy of the sonographically important structure in the wrist joint, to apply sonographic examination technique for the evaluation of normal anatomic appearance and morphologic changes in the wrist joint, to integrate patient clinical history with the sonographic pathological changes in the wrist joint, to predict possible demographic, sports, occupation, age, gender related pathologies, to know the pros and cons of the ultrasound imaging, to compare the ultrasound with the other imaging modalities, to predict the sonographically differentiate various pathological appearances in the wrist joint. For this purpose, we will discuss about the anatomy of the wrist joint, some examination techniques from the volar and dorsal aspect of the wrist joint, and some of the important pathologies of the wrist joint. So first of all, we are coming across the anatomy of the wrist joint. So the wrist joint consists of several sinewy structure between the distal radius and ulna, the proximal carpal row, scaphoid, lunate, triquetrum, pisiform, and the distal carpal row, trapezium, trapezoid, capitate, and hamate. So the radiocarpal joint between the distal radius and the proximal row of the carpal bones, uh, and the distal uh, radioulnar joint between the radius and the ulna are separated by fibrocartilage called the triangular fibrocartilage complex, which extend from the ulnar aspect of the distal radius to the base of the ulnar styloid. The mid-carpal joint is located between the carpal bones and is separated from the radiocarpal joint by two intrinsic ligaments, the scapulonate and lonotriquetral ligament. So here you can see in these images and all these important ligaments and the carpal bones. These are small bones and eight in numbers, and this is a complex joint between the two long bones, radius and ulna, and those seven small bones and five metacarpal bones. The scapulonate ligament is U-shaped in appearance and in the sagittal plane, with the open end of the U distal, and is consists of volar portion, the thin proximal, a central portion, and the thick and mechanically important dorsal portion of the scapulonate joint, ligament. Sorry. Structure enters the wrist through several fibro-osseous tunnels, and the volar wrist, the carpal tunnel, contains the median nerve and the flexor digitorum profundus and superficial tendons, and flexor pollicis longus tendon. So here you can see in this image the fibrous flexor retiniculum extend from the pisiform bone to hamate hook and to the scaphoid and trapezium to form the roof of the carpal tunnel. We will discuss it in detail later on. The Guion tunnel and the ulnar canal on the ulnar side is also volar, adjacent to the pisiform, which contains the ulnar nerve, artery, and vein. Other tendons, the flexor carpi radialis and the palmaris longus tendons, are located outside the carpal tunnel. Although the flexor carpi radialis is within its two fibroosseous canal and distally is associated with trapezium.